right. So why don't we go ahead and get started? Welcome, everyone. I know the big, exciting discussion is going to be vaccinations. I'm going to get to that in a moment, but we'll go through our normal order. Let's see here. So we'll start off with the State of the Union. No surprise, cases are going up. Ontario County is still the hotspot locally, as we'll see in a moment from the data coming from our friends down in Tri-County. But Monroe County is still heading in the wrong direction overall, unfortunately. Interestingly, there are now 3 states in the U.S. when you look at their per capita rate of infection, are the highest rate of infection in the world. So Arizona, Rhode Island, and California are higher than any other nation in the world as far as cases per 100,000. Now, granted, people argue North Korea is not reporting accurately, Iran is not reporting accurately, and that is almost certainly true. The most cases per capita in the world being reported right now is the Czech Republic, which has 653 cases per 100,000 in the population. Arizona has 785 cases per 100,000 of population. Rhode Island, 671, California, 658. So clearly it's not just us, it's the entire country. But certainly, things are not going well locally either with our number of cases. As you can see, we added another 646 cases in the last 24 hours. There were 29 reported mortalities just in the Finger Lakes region in the last 24 hours, which is probably catching up a little bit in reporting. I don't think all of those truly occurred in the last 24-hour window, but nonetheless, obviously that's a lot when you're looking at it as a whole. So trends are still going up. Monroe County, after having that peak, which was probably due to a little bit lower testing volume when we had that 10.1% positivity, we're still hovering right around that 10% threshold at this moment, but down to 9.8%, as you can see. Everything else, still kind of trending in the direction we've seen before. As you'll see in a minute from the graphics, we get a little bit of a Richter scale in some of these. The weekends throw a monkey wrench into things, but here we go. There you see. So we're still on that upslope, not quite. It's obviously more of an upslope now than it even was way back in May, June timeframe. You can see locally when we're looking at our hospitalization rates and ICU rates, they are still on a steady incline overall. For the team at the U of R that was modeling out the anticipated hospital occupancy status, we're now kind of hovering into somewhere between anticipated additional 25% to 30% volume that will likely be hospitalized within the next couple of weeks, knowing that the peak of the curve is expected somewhere in that week on or around January 20th. As you can probably tell, it gets reported that we still have about 28% hospital vacancy, about 30% ICU vacancy. Again, those are vacancies based on surge created capacity. So for instance, Highland Hospital, I know this morning was 127% capacity, but they have opened up the Collins Auditorium and placed a unit of beds in there where Grand Rounds has usually been held in the past. They have another conference room that they can convert to a small patient unit as well, and they actually have hospital hallway units additionally. So pretty much everywhere that a patient can be placed right now, patients are being placed. And so staffing for that is certainly remaining a concern. Many of you probably heard that the Sawgrass Ambulatory Procedure Facility has paused all facilities. They are now borrowing staff from Sawgrass to be able to cover the hospital population, both to backfill the staff who are out with illness, but also to cover the increasing number of people in the hospital. So it is still an all hands on deck status currently. We do anticipate that we are likely still to see at least another probably 2 weeks of this surge. And then hopefully, if all things go as modeled and anticipated, we should start to see some plateauing around about that third week of January, is the current prediction. There is still that doomsday scenario where we could go up as much as another 50 to 60% of current capacity. All current data points to the fact that that is very unlikely at the moment, which is still good news, but something we still have to keep an eye on. Interestingly, when you look out at Ontario County, and you'll see at a moment, and you can see this kind of a Richter scale. It all depends on weekends and the like. So this is for our friends down in Tri-County. You can see Ontario really continues to surge and kind of lead the pack as far as positivity. Interestingly, when you look in Ontario County and their data reporting, most of this, there was one fairly large funeral where there have been 12 positive cases that have all been contact traced to one funeral. But most of these positivities are spikes from families, folks who are living in the same household and spreading it locally. So there doesn't seem to be any major large outbreaks at this moment, other than a few congregate living facilities that have had some outbreaks, group homes, that kind of thing. So something we'll continue to keep an eye on, but clearly we're still in a critical status at the moment as far as the number of sick individuals. You also may have noticed or heard after Monday, I said there was still no reported case of the UK variant that had been reported in New York State. I said that at roughly about 12:30, and then at about 1:15, the first case was reported in Saratoga County in New York, and that has now been confirmed. I think there's now been a couple of additional cases since that time. So this UK more rapidly spreading variant is in Monroe, or is in New York State. I am not aware that it has been isolated within Monroe County or the Finger Lakes region at this point. But the person who was first identified in Saratoga had had no travel, had had no visitors, had had no clear exposure. So clearly it was more likely a community derived exposure, which means it's probably amongst us, whether we really realize it or not at this point. So, what does that do for us? Yes, that probably does contribute to an acceleration of hospitalization. However, it does not seem to be associated with any increase in mortality or the like that we know of at this point. So that's kind of where we stand at the moment. Testing still, there was a relative plateau for a bit through the holidays. We have started to see that acceleration in demand for testing. Fortunately, the capacity still remains fairly good. With Sawgrass pausing operations, we anticipate that that will decrease the demand for that pre-procedural asymptomatic testing, which should create a little bit more capacity to buy us time, even as probably more people start to come back symptomatic. So we are still in a pretty good place from a testing availability at this point, and don't have any reason to believe, at least in the short term, that we will tap that out. So that's kind of State of the Union. Nothing more to report differently at this moment. On to vaccination. So the good news is, if you are within the sound of my voice and you have any patient interaction whatsoever, you should have now received an invite from someone that you love, either us, our friends in Tri-County, our friends at Oak Orchard, some friend that you know down the street, inviting you to get your vaccine. If you have not, or if you think I'm crazy, please feel free to reach out to us as quickly as possible. So it should be that anyone that has any patient role. So if you have no patient-facing role, you are never going to see a patient, you're always going to be a backroom office person, the governor has not cleared that group to go as of yet. Many people have reached out because we have office staff who were not invited, but do not have patient-facing roles. That was not a mistake. Again, it is not our choosing or at our liberty to amend. If folks do not have a patient-facing role, then they are currently not cleared, and I don't have a clear itinerary of when those folks will be invited. My best guess at this moment is that group would go based upon their own age and medical risk profile at this moment. There has been some discussion of whether an essential worker pool may be created. That does not currently exist within the guideline that's been put forward by the governor's office at this point. So I know, our goal is to get everybody in our offices vaccinated, heavily supportive of that. But at this time, you have to have a patient-facing role to be vaccinated. Folks have reached out.
Clarify something real quick.
Oh, please.
Do you mind if I clarify something really quickly, Chad?
Yes.
Just that the invitation and the email was sent to all the email addresses that were submitted to Chad on those spreadsheet templates, and to emails that we had in the database. So there might be some folks in your practice who didn't receive an email because we don't have them in the database, or we didn't have a form from you. So feel free that email can be forwarded to them. Those links are not unique. And you can forward that email to those patient-facing healthcare workers that are in an AHP practice, and they can use that. Just wanted to clarify it.
Yes, point. Thank you very much. I will point out that, and Renee is correct, that email is not unique. Those links are available to all. However, do be mindful, not that anybody is going to try to shortchange or do something they shouldn't do, but there is now an effort that is being put forward by the governor's office that folks will have to attest patient-facing responsibilities. And if they receive the vaccine and do not have such responsibility, there is heavy penalty and legal ramifications to that. So this is not something that you want to send it to your best friend or your cousin, or just give it to that person in your office because nobody will ever know. This, all I can tell you is that the governor's office is being very touchy, is the word that I have used to date about that. And I don't know that this is something that we want to test them on at the moment for certain. Okay, so that's what I have there. The other thing I want to cover, lots of folks have asked questions about why did the timing happen the way it did? Why did we get delayed? Who got vaccine before? So I kind of wanted to go through a breakdown of the timeline just so folks get a better understanding of exactly how this transpired and why it transpired the way it did. So first and foremost, and again, I could only serve to aggravate you, so I didn't bring this up on Monday. But as of last Wednesday morning, we were literally about 10 minutes from being able to send out a notice inviting everybody to get vaccinated last week, at least from the U of R. However, in the last seconds before we were getting ready to start pulling that trigger, the leadership at the U of R got a clarification from the governor's office that said ambulatory teams that did not have inpatient responsibility could not go until week 4 of the vaccination cycle, which started on January 4th. So that delayed everything, at least until Monday. The promise at that time was then that by Sunday, the U of R would receive instructions both on how and when and what vaccine supply they should be using to vaccinate folks. At that point, actually on Saturday, I believe it was, our good friend, who I can see on the screen right now, Nicholas Apostolaris, reached out to me and said that Tri-County, as an FQHC, had actually received a supply of vaccine and were given the clearance to administer it to all 1A healthcare providers. So that was healthcare providers who have really any patient-facing role. So we then began that process of benefiting from his goodwill and sending folks in his direction. Some folks, as we reached out to them, that traveling down to Dansville was not ideal for them, or they were concerned about how they would staff their office, so that didn't work for everybody. But then Sunday came, and there was basically no clear instruction at that moment, other than for the U of R, they would be expected to vaccinate ambulatory providers this week. Sunday night, or actually Monday morning at about 1 a.m., Rochester Regional, I think they actually got the notice Sunday evening, got the notice from the governor's office that they were in the penalty box. So Rochester Regional, as you probably may now be aware, was in the bottom 5 of hospital systems in the state as far as utilization of their vaccine supply. They had only administered about 25% of their vaccine at that moment. So the state sent them a letter that basically said you have to use your vaccine supply by Friday. And if any vaccine supply that you don't have will be confiscated, your allocation will be reduced, and you could be fined up to $1 million for not utilizing it. So that lit a fire. In that, they were basically told they could use the vaccine they had in supply to administer to ambulatory staff immediately. So that's when they opened up their walk-in clinics on Monday. The U of R, we queried, and they reached out to the state and initially were told that they would be getting a separate supply of vaccine earmarked for ambulatory staff, but that they could not use the supply that they had received to date. Yesterday at 3 o'clock, we got clarification that that indeed was not the case, that the vaccine they had in hand, they could administer to the community effective immediately. So at 3 o'clock yesterday, we began the process of generating the letters and invites that went out to you. And I think most of folks got those by somewhere around dinner time-ish or so last evening. So, folks have asked, why could I have gotten it here? Trust me when I tell you, the state, and I'm not blaming them. They're getting 1,000 phone calls a second. They're getting fielding requests and things from everybody, but it's not a come one, come all way that they're distributing this information, and you are not allowed to deviate outside of the instruction that they provide. So that was why the things rolled out as they did. As many of you know, we started offering spaces as they were coming available. So the Tri-County team offered spaces first, and we were trying to fill their spots without overwhelming them with 1 million people calling them. We then got outreach from our friends at Oak Orchard, who just joined the network at the end of last year, who also had some spots, which worked well for those in our northwestern region of the network. Even our friends at Acute Care Kids and Webster Urgent Care reached out and were able to get folks in for some vaccine administration. So as pockets came open, we started sending people as best we could. I know that means that some people didn't get it as quick as they would like. I realize that this would be ideal if it could have gone differently. But I think I'm pretty happy at the end of the day that all of us, from the day that we were allowed, pretty much should be able to get vaccinated within the next 2 or 3 days, ideally. So the other reason I bring this up is for all the fervor and anxiety and irritation that we experienced. Know that patients are going to get the queue in the next 1 to 2 weeks. And everything that we experienced, they're going to have about tenfold, and they're not going to have the insight and wherewithal to know the difference. So all of us are going to have to do the exact same thing and turn around and be able to do that vaccine administration to all of our patient population. It is going to be tough, to say the least. And the estimation right now, the CDC is recommending that the vaccine go to 75 and older, first wave. The state had initially indicated that it would go to 65 and older and all patients with chronic medical conditions, of which there's a list of 11. It's cancer, heart disease, sickle cell, obesity, you name it. The over 75, there are about 118,000 patients within our network that will meet that criteria. The 65 and older and or chronic disease goes to about 780,000 people just in the AHP network that'll meet that criteria. There were roughly about 1,500 to 2,000 of us. So as you can imagine, as much fun as we've had in the last several days to a week now, we're going to amplify that by about 70 to 700 fold in the next 1 to 2 weeks. So it's going to be interesting. As far as how this is going to work as we transition to patients. So at this moment, I think we are probably another 10 to 14 days from patients being turned on. It was initially going to be January 11th, but as I understand it, patients have been possibly pushed out maybe an additional week. So we may get a little reprieve on that. Nicholas can tell me if he's heard differently because he probably has better insight than I have. Good. Okay. That sounds like he's agreeing. So probably roughly about 10 days from today is when we can anticipate we may start seeing patients go live, so to speak. Current estimation, I know within the Finger Lakes region, they're already looking at large hubs to do vaccination. So Blue Cross Arena is likely to be a hub. The convention center is likely to be a hub. There was word yesterday that what very well may happen, because the anticipation right now is we are only going to have Pfizer and Moderna to start this process, is that the state may send Moderna to central agencies. So our FQHC partners, U of R, probably the county, and then they may be able to distribute that to practices in a just-in-time process. But know that when you pop the vial, you got an hour to basically administer that 10 to 11 doses inside the Moderna vial. Pfizer, I don't know, is logistically going to be possible to be able to administer from a clinic setting. But it does sound like the governor's office is willing to allow administration from within the clinical setting. So that will obviously spread the ability, if you're one of the approved sites and applied to the state, to be able to do so. As far as whether the state will be sending vaccine directly to your practice, at this moment, I do not know. I'm not sure. It doesn't seem likely at the moment because long-term storage, the Moderna vaccine can be refrigerator stable for about 30 days, but long-term storage has to be at a colder temperature. Obviously, the state's wanting you to use it very quickly. So that will play out here over the next week or so as we learn more. But I just want to give you kind of a general sense of how this kind of unfolds. It'll give you a sense of how things are going to happen for all of us in the coming days to week as we're looking at transitioning to administering to our patients. So when I tell you, and Nick and Lucia, everybody on here can probably attest, when I tell you that things could change in 2 to 3 hours, that is not an exaggeration. So with that many people getting ready to go live with needing vaccination, I can only imagine that the guidance and we were told this, but then somebody told me that, and I got this form, but it contradicts this other form. That has been pretty much state of the union for the last week now with this process. So breathe deep. It's going to be fun. It's going to be painful. We will now be from the side that gets to throw stones at why aren't people giving us vaccine, to everybody throwing stones at us because we're now the vaccinators. So the shoe will be on the other foot. But it's, part of this is to be able to kind of disseminate that information as quickly as possible. It may even necessitate that we increase the frequency of these discussions so that we can distill that information as quickly as possible. Because at least through the U of R and some of our partners, we do have a direct line now into the governor's task force where we can get to this information a little bit more quickly. Fortunately, there are a few of us, including Lucia and myself and others, who are on the Finger Lakes vaccine task force. So that allows us to get some of this information a little bit more firsthand. But I can tell you there could be a vaccine task force meeting at 8 a.m. It's like somebody changed the discussion at the task force meeting at noon, and then the wrap up at 4:30 sounds like we're talking about a different state entirely because it has nothing to do with what we talked about at 8 and noon. And so that is probably going to continue for the foreseeable future right now. So just want to give you a sense. Everybody has been busting their butt. Huge kudos and thanks to Nick Apostolaris and the Tri-County team, the Oak Orchard team, the Acute Care Kids team, the U of R team, Highland team. Everybody has really gone above and beyond and tried to do everything they can to make this as efficient as possible. But it's just damn hard, quite honestly. That's just the reality of the game. So now you understand the insight, and you're all going to get to experience it a little bit more closely here in the next few days. So we'll all be much better friends in the days and weeks ahead. So that's going to be fun. I think that's really all that I wanted to go.
You've
Yes.
got some questions about vaccine that are popping in the chat. You want me to read them to you and you can go?
Sure, please feel free.
Okay.
You've probably been watching it tonight.
So one question was, what does administering the vaccine to school staff look like?
Yeah, so right now, to my knowledge, and anybody feel free to jump in and correct me if I'm wrong, I have not heard that school staff is getting any special dispensation at this moment. I know that there is the first responders, there's coroners and morticians, congregate living workers, all those folks have been specifically called out. There has been some expansion, so any allied health provider, nurse midwives, PT, optometry, what have you, they're included in the right now group. But I have not heard that there is this other essential workers category that was initially put into that we'll go with the 75 and over crowd, but I have not heard that that's still on. The CDC guidelines don't exactly match with the state's guidelines, so I'm sure we're going to get more clarity about that in the days ahead.
Yeah, and I would just add to that, I do know for some conversations I was in this morning that they're looking to move school nurses or school health personnel up, and looking to see if they can get them into the vaccination pool within the next week. But it's not clear what's happening with teachers yet, even though I think there was a lot of conversation about, as you said, Chad, putting teachers up into a higher risk category. But we just don't have confirmation on that.
Right.
And then there's a question about, do we know if retail pharmacies will be administering these vaccines as well to the general public, or will it be kept in the house?
So that is the $1 million question that is being parlayed about right now. So the anticipation is yes. And in fact, I can tell you that answer will almost certainly be different on January 20th, if it is not on January 19th, because the Biden administration has already put forward the math that there are 20,000 CVS and Walgreens locations. And if each of them can administer 50 a day, they would be able to accomplish Biden's goal of 100 million doses in the first 100 days. So if it doesn't happen by January 19th, I bet money it'll happen by January 21st. But I don't know the answer to that at this moment. That's the other wrinkle in all of this, is all this excitement is going to unfold on or around theoretically by January 18th. And then there's this other thing that's going to happen on January 20th that's going to change the landscape entirely. As you may have seen, the state got clearance for 16 sites for the National Guard to pilot administering vaccine. I've been kind of conjecturing, maybe they started listening. I don't think they did. But the only way we're going to get to the level of vaccine we needed to administer to get to that 6 month, everybody in the US that wants vaccine can get it, that Biden has put forward, will be some type of utilization like the National Guard. So I anticipate it's going to be all hands on deck come January 20th, and probably will be community pharmacies, at least CVS and Walgreens, maybe the National Guard, and then probably all of us that signed up to administer. But again, I'm in charge of nothing.
We like to make you think you're in charge of a lot, though. It's fun. So there's just two other comments. One, Steve Cook put a nice link in. There's a link at the state. Am I eligible, for COVID vaccine? So that link is there in the chat for folks to copy and utilize or click on. And then there was just some messaging from Tim Geen that there are Cute Kids actually is doing some vaccination for Webster Central school nurses. So I really do think the school nurses are being pulled in, both within Monroe County, and I know that there's efforts to look for all of the counties and the schools in the Finger Lakes region.
That is good news.
Yeah.
Yeah, and I see Erica had sent me the question. The CDC says 75 and older is first pass. The New York State says 65 and older. That is absolutely correct. It has not been vetted at this moment or differentiated. So I don't know the answer to this moment. I will even say that the am I eligible, if anybody's played with it, it's great. I'm not trying to dissuade from it, but there is so much of this that hasn't been built out. Even what the governor put out as of the end of last week, if you look at the grid, there's a bunch of rows that are just TBD, 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 TBD. So right now, if you put in, I played with it this morning just to see what it said. I listed myself as a 76-year-old in Rochester, and it just says you're not eligible at this time. It doesn't tell me when, doesn't tell me whether I will be, whatever the case may be. So that's not going to be perfect. And unfortunately, there's a lot of these decisions that just haven't been fleshed out yet. And some of those fleshing out may occur within the 24 hours before it's go time, quite honestly. So there's that little bit of fun to look forward to as well.
And then we got a question about providing guidance on how practices obtain more vaccine. The DOH is overwhelmed and can't get a straight answer. Is it through NICES or McKesson?
So that's a great question. I can't tell you the answer to that at the moment. Right now, well, I don't know. It is still not clear to me whether it will come straight to the offices that have signed up or whether it will come through some central hub. If you'd asked me this question yesterday, I would have said it would have to come through a central hub and it would be dispersed based upon utilization. So if you used 100 doses yesterday, you would be able to get potentially 100 doses today as long as it's available. There has been some mention of potentially going straight to practices. How they would deliver that, I've got to imagine it would be through like a McKesson type process, but I don't know the answer to that at the moment.
And Chad, you and I had this conversation a little earlier, but I think for people on the call who have office staff or themselves who are being vaccinated right now, there have been some questions coming in about what do you do if someone does have side effects from the vaccine, which resemble the symptoms of COVID, and at what point, can people still come to work, or do they need to be tested? Do they need to stay at home?
Yeah, that's a great question. So I will tell you, I don't have extraordinarily firm guidance on this at the moment. I know initially the recommendation was to stagger staffing getting the vaccine just so that you didn't have everybody potentially manifesting symptoms all at once. I will tell you that for the vast majority, it's sore arm, followed by some headache, maybe some mild malaise, joint pain, that kind of thing. Some people just, really want to take a nap for a little while. The vast majority, myself included, thankfully, didn't really have much at all. But I have not heard a lot of folks that are actually manifesting a fever. So my guidance at this moment would be if you are febrile and are just having I got a vaccine and it kind of sucks kind of symptoms, you are still able to come to work doing your universal precautions as you should anyway. If you mount a fever, I think you have to go into the isolated home process because I don't think mounting 100-degree fever is a very common manifestation at this point. I have not heard of it to date. Obviously, you're going to have to be monitored for those who haven't gotten the vaccine yet. They're going to monitor you for 15 minutes anyway. The vaccine goes in cold, so it doesn't feel especially exciting and fun, as I can say from my own experience. And it does feel like somebody punched you in the shoulder, but the vast majority are doing just fine. The second dose is a little bit more exciting for folks who have gotten it in the last couple of days now. I know one of my partners in cardiology who does a lot of ICU work, he got his second dose 2 days ago, I think it was. And he was pretty much down for the count for about 36 hours. Felt really tired, had diffuse joint aches, and he's younger than me. So anyway, that being said, I have another one of my partners who she may weigh all of 100 pounds and she just had a little bit of a sore arm. So maybe my other partner's a whiner for all I know. But I have heard from multiple people that the second dose is a little bit more intense, even for people who do not tend to have vaccine side effects. So take that for what's worth. I'd say no fever, go to work. You should be fine. If you have a fever over 100, probably should stay at home and isolate. All right. Oh, the other thing I should mention, because this question has come up multiple times. What if I have had COVID or been COVID positive? So right now, you have to be at least 90 days from positive test before you can get the COVID vaccine. Why is that? From everything we know, you should have at least 3 months of immunity. There was actually a journal article in Science today that suggested that the vast majority will have up to 8 months of immunity after primary infection. So that's great. So because of the paucity of the vaccine, the initial plan was to use that innate immunity generated by infection to our advantage. So at the end of 90 days, you will theoretically be the highest risk person because you were a tier 1A individual. So you would be able to get the vaccine kind of first out of the gate on day 91. So what I would tell everybody is the links that we sent out to you are going to remain active. It will just refresh with all the new vaccine clinics and dates as they're added. So once everyone is at 91 days post positive test, then you are free and not have any delay that we anticipate at this moment. So that's another one that's come up. There's been a ton of folks, and we'll get into this more. I know Erica Dobson actually put together some common questions, kind of urban legend things about the vaccine. This is going to become even more important as we're starting to administer to patients. So, does it cause infertility? I can't get it because I'm pregnant. There's a lot of these things that are even coming up to some degree amongst healthcare workers. So we can send that out so that you have that, because I'm sure those questions are going to start coming hot and heavy in the days ahead. So that'll be something to arm yourself with ahead of time. Oh, perfect. Erica just put it out there. So there you go. It's up on the chat right now for your viewing pleasure. And
that one's just the comparison between the Pfizer and Moderna.
Oh, okay.
Questions around that, which Renee is going to include in communication. And then I'll clean up what I've sent out internally for the rest of your viewing and send it.
Perfect. There you go. All right. I think I have talked enough. So I'm going to shut up and I'll hand it over to LJ, who I think had a couple issues she wanted to cover.
Actually, not much. You kind of covered all of them in all of that stuff there, except for the fact that there is a PCP, pediatric primary care provider advisory committee meeting tonight, 7 o'clock. It's a Zoom meeting. Those who serve on that committee should have received the link. If you did not, please reach out to us, and we'll see you then. It's an hour and a half long meeting that I'm anticipating we're gonna end shortly after 1 hour and give you guys a little bit of time back, but just go through some highlights. Chad covered all of the big stuff on vaccines here, so I think that we'll be able to make it pretty efficient. That's all I got.
Renee, do you have anything you want to throw in?
Sure. PPE distribution next week, Thursday, save the date. We'll include that reminder in today's email. The survey, the email alerting you to complete your PPE survey was sent out earlier this morning. So you should have that. And I think that's all I have.
Perfect. Okay. Any other questions that folks have?
Sharon, I guess I would say one more thing is just to make sure everyone knows, and if you covered it already, I'm sorry, I'm getting so much email and phone calls and stuff. I've got one ear in this call and one ear doing other stuff. That, many of you have been in touch about other healthcare professionals who are not in AHP, but who are eligible for vaccination according to the governor's list. And that we would encourage you that those folks need to go to the Department of Health clinic. We could also send information about Oak Orchard clinics if they've got more schedule. We'll include that in today's email as well. But the DOH clinic is definitely, I would say, the best option for those folks.
And we're at this moment, the U of R has not gotten clearance to vaccinate those folks, is my understanding. So that may change in the hours and days ahead, but at this moment, the DOH MCMS has been kind of organizing that. The DOH clinics were specifically geared for that group. I know there has been some discussions at the vaccine task force about expanding the offerings to the health systems to be able to help vaccinate those people more efficiently, but we're awaiting that guidance. So as of yet, that's not an option. And I know even some of you have reached out because you have a spouse who's something in the community, but not affiliated with AHP or GRIPA or employed by the health systems. So, as Renee said, our friends at Tri-County still have some availability, I think. Nicholas can tell me if I'm lying. Our friends at Oak Orchard, I think, have some availability. So there are avenues, but the DOH is going to be opening clinics inside the city here very quickly as well. All right. At least for today and tomorrow. There you go. All right. So we do have some down south as well. Who's the Oak Orchard contact? Renee, offhand? Who have you been talking to over there?
At Oak Orchard, there is some emails, some links I can send you. They are actually on the governor's website of, vaccination locations. But if someone's asking, Chad, just let me know who that is, and I can send them the document that has all those links where they can register. There's no individual contact or phone number to call. They have to register
Yeah.
online.
It's Lucia. Renee, if you wouldn't mind emailing me that information, that'd be great.
Sure.
Great.
You got it.
Okay.
Thank you.
Terrific. Oh, there you go. If you need to look in
There
there.
you go.
Nice.
Thanks,
Right answer.
Danielle.
Thank you.
Hey.
Thank you.
The
Thanks,
beauty of the chat
Danielle.
room.
This is a very efficient group.
This really is. You guys are great at this. We should do this all the time.
Thank you, Danielle.
And I know Lucia emailed earlier, what are we going to do when we don't do with the vaccine anymore? I don't know. Like, when there's no more COVID and everybody's vaccinated, like this is going to be the most boring place in the world. Like there's nothing to do anymore. You have to hang out and drink all day long. That'd be fun.
I know.
All right, guys. I
Nice
think
job.
we covered all the issues. Thank you, everyone, for your patience. Thank you for everyone who has been assisting with getting this done. Renee and LJ for being up until 9, 10 o'clock last night and answering a million emails in between. So if you have not gotten a shot and don't know how to do so, please reach out to us and let us know so we can connect you. But hopefully things are going to be on the up and up here very shortly.
Excellent.
Thanks, everybody. We'll see you next week.
We're on a gravy train with biscuit wheels at last.
Hi, everybody.
Take care, guys.